the rules for establishing a sterile field. Okay, so first you want to bring your table up to your waist level or elbow height, okay? You also want to make sure, and I don't know if I mentioned this before, the surface that you're going to be using needs to be clean and dry. So if it's not, we talked about wicking. If it wicks and we have a wet surface, we have contaminated our surface, so make sure it's clean and dry. It doesn't have food particles on it, okay? Or, a urinal has been sitting there. You're going to wash your hands, of course, before you do that. Bring your bed up to waist height. You have your table. If you need more than one, go get another one. Have all your equipment ready. Explain the procedure to your patient so that they know that what you're doing needs to be as clean as possible and that they cannot touch it. So, show them before you set it up where they can touch, or if they need to talk or cough to turn their head in what direction that is away from your sterile field. Okay? So after you do that, you also want to remove if you have a large jacket on that's blousy or loose, take it off. If you have extra jewelry on that you think, if you have a really big watch on that day, take it off, remove it, okay? Then we're going to examine our package. Most of our prepackaged things are sealed. We're going to check first to make sure it is completely sealed. It doesn't have any punctures in it, any holes. We're going to check the expiration date to make sure it is not expired. It is not considered sterile if it is expired. We do not use it, okay? We're going to check the contents in our sealed package to make sure we have everything that we're going to need. Some of your Foley kits, for example, don't have everything that you need. You may need some additional sterile packages that you'll have to add to your field, like additional 4x4s. We have to do that a lot. We're also always bring extra sterile gloves. What did I tell you about that? Always have at least a second pair because you can save your sterile field. If you've contaminated or you forgot to pour your liquids, if you have that second pair, you can go right here, put those on, and you don't have to start over. Let's see, we already looked for that, check the contents, so make sure you've checked your contents. Then after you open it, to open it correctly, we've got to start away from us, and when I say away from us, we're not going to do this. Do not go straight over your sterile field to open the first flap, okay? So position your bed, your table, and we're going to move it with our feet a whole lot. You're going to get real comfortable doing that later. You're going to come around and do that first flap, okay? Then we're going to do side to side. Try to stay in that 1-inch border that we have because that flap's open right there. I would do this, okay? So we're going to do the side to side. Remember what I told you about kind of pulling it so it doesn't flap back over on itself? When you come to get the last one that's going to come towards you, do not let it touch you or your person. So step back just a little bit and pull that. Now I told you we can move this. If we need to move it to the left or to the right, we just pull it by that 1-inch border that we have. Just know that whatever falls over the table is no longer sterile. So if you've moved it over here once and you want to move it back later, you can, just don't put anything sterile that you need to be sterile right there in that spot, okay? We can also square it up. You know how that was at a weird angle? You can square it up. We can turn this entire tray later once we have our sterile gloves on, okay? Now let's talk about, and I'm going to go ahead and square it, okay? We'll pretend like it was already that way. Now I'm going to talk to you about adding items to your sterile field. We cannot turn our back on our sterile field. We cannot hover over it. We don't want to talk incessantly over it. We don't want to reach over it. So we do this quickly. Have your items ready. Same thing, any item that you believe is sterile that you're going to add to the field, make sure that you've checked the contents, that it's sealed and it's not wet, it's not expired. You can open it this way, get it started. Don't start here over your sterile field. Start here, back here, okay? And then quickly, as you open it, quickly drop, then stop here. Do not reach down to the trash can, okay? Drop it from here, we'll clean it up later. Okay, see how that landed? I can fix it in a minute when I have my sterile gloves on. Let's add something else. Another way that you can do it, that you'll do a lot if you were handing items to a physician, We do it this way. We can turn it out and they grab it. Rachel, you missed that part when you weren't here the other day about how to assist a physician holding something. We turn it back like this. Whoops, I'm not doing a very good job of landing. You can also do this way, where we go out like this, okay? So as long as you just drop it and right here, okay? Now let's talk about, now if this had landed here in that 1-inch border, that is considered not sterile anymore, okay? So we're just going to need to know, we're going to leave it there, we're not going to remove it, leave it there, just add more, and do not use that one, okay? So, but if it lands like this, once I have my sterile gloves on, I can fix it. I'm usually, once I have sterile gloves on, I'm going to rearrange everything on my tray, okay? All right, heavy items such as syringes, they bounce. So we're going to be very careful. Get this open and ready, get close to your field and let it lie. Then drop this, okay? Does that make sense to everybody how we do heavy items? Okay, to pour our liquids, let me go ahead and open these. 4x4s. Again, we always make sure I'm going to hold it securely underneath. Pull this completely off. I'm going to drop that. I'm going to hold it underneath. Put this right here. Liquids, to add liquids or pour liquids, I'm first going to make sure I have the right solution. They look the same, a lot of them. They'll be the same color. So read it and make sure it's what you need, that it's not expired. Has it been opened before? If it has, it should have writing on the back with someone's initials, date, and time. It's only good after it's open for 24 hours. So make sure you look at the time. When you open a new bottle, you are expected to have a Sharpie in your pocket and put on there the date, the time, and your initials that you opened it, okay? If you picked up a bottle that you could tell, you know, the solution is down to here. You can tell it's been opened and nothing is written on it. Should you use that? No. It could have been sitting there a month, okay? So don't use it. All right, so we're going to pretend this is a new bottle. I don't have a trash can with me. So that's another thing to think about is putting your trash can strategically next to you so that because you're going to need it. Okay, I'm going to palm the label. That is to protect it from anything spilling on it and me not being able to read what the contents are. So I'm going to unscrew this. I'm going to hold this up like this. If I'm going to be pouring this for a little bit, I can put this upside down on the table, okay? It would never go down like this, okay? Or you can just choose to hold on to it. Lipping it means you're going to go here. Do not go down to the trash can. Do not bend forward or bend down. You're just going to get rid of just a little bit of liquid, and then you're ready to pour. When we pour liquids, it has to be close enough not to spill and splash, but far away enough that we're not contaminating our container that we're pouring it in, okay? So use a second hand to support it. Go closely. Pour what you need, okay? We're going to put our cap back on completely. And since I just opened this, at that time, I would write my date, time, and initials, okay? And now, and this is what y'all will do for your checkoff tomorrow. We'll have you open the package. We'll give you a few things to add. We'll talk to you about adding a heavy item. I may say, okay, this item landed here. Is it still sterile? Can you fix that? Okay, so I'll expect you to know that. I'll have you pour liquids. It will occasionally spill, guys. That happens. So you would just voice, okay, I spilled that. So I've contaminated my sterile field and I would have to start over. You will not have to start over doing your skill, but you need to voice that you did contaminate it, okay? All right, so now I'm going to put on my sterile gloves, and y'all know how to do this. So at this point, I would put on my sterile gloves, and I'm not even going to open these. I would put these on. Where can I go from here? I have my sterile gloves on, okay? So can I touch these things now?
Yes.
I have sterile gloves on. Yes, I can pick all this up and move it around to whatever I need to do. I can add items here. This is one other thing we talked about, and I don't have gloves on, but Rachel, if I were to pick this up and I have a sterile field and I've got to pour liquids, I would put this in here, okay, and I'm going to wring it out. We always wring our things out. And this is my patient over here to my right. This is where my liquid needs to be, okay, because I'm going from here to my patient. I would not want my liquid on this side of my sterile field because
I go across the package.
I cannot go across. See, I cannot drip water. I have contaminated my sterile field. So you have to think about that in your setup, because guys, in a few weeks you're going to be here. Okay, you're going to pack a wound, and we have to pack it with normal saline. So y'all got to think about and practice. That's what's great about your practice. Practice doing it and have someone watch you so that you can decide just where everything needs to go. Okay. Okay. What else do I need to say about the liquids? I think that's it. Just make sure you put it in the correct place. If it spills or splashes, you have contaminated it. We always wring things out, okay? We don't do anything soaking wet ever, okay? So, to put on your sterile gloves after you've opened up your sterile pack, you will either have a second table or you can do it on the bed. If this is not a really infectious patient that has really soiled bedding, so it just depends on your patient. If we've got a good area that's clean and dry, yes, we can do it. If we raise the bed level up before we got there, okay? Before we get to that point. That's what y'all will do tomorrow. That's what you're expected to do in your checkoff, okay? All right, any questions about sterile setups?
You don't touch it.
No, you cannot touch it. If it touches your body, you have contaminated it, okay? And that happens, as a lot of students do that. They're nervous, they're not paying attention, and that last flap, they've done a good job until there, and then that last flap hits them. Or, once they've opened it, and they're going to add, maybe they're adding an item, they're too close, okay? And they touch their sterile field with their stomach, and they don't realize it. So that's why it's important for y'all to practice watching each other, so that you can say, oh, you just broke sterile field. Now, can I turn my back to set my liquid down? Oh, can I lean down here at all? What if, Rachel, what if this was here and the doctor asked me for that, and I'm gloved up, I have my sterile gloves on, so I'm sterile, and he says, could you hand me that big syringe? I'm going to need that now.
You gotta
and
go
I
by
did
your...
this. Can I do that?
No.
No. I cannot do this. This is not sterile, okay? So I have to, if this table was here, I would move that, and I would go around to it, okay? Pick it up from here, careful not to touch anything or my table, and then hand this to the physician, okay? Away from my sterile field. Don't reach over it. Don't talk over it. Don't hesitate. Hover over it. And this happens with students. Let me pick up another package. You're nervous, okay, tomorrow, and you're trying to add you're worried that the sterile item is going to fall. So you're standing here going, and they're going to say, okay, you've hovered too long, okay? So be ready. Start here opening it, okay? Get comfortable with how you want to open it, whether it's like this, okay, or whether it's like this, however you're comfortable. But get it started, okay? Take a step back, get it started, do it quickly, drop from there. Now, be careful and not let it drop onto your sterile field like I almost did, okay? Any questions?
So tomorrow, are we going to act like the patient's going to be laying in the bed?
Mm-hmm. Yes.
So we're going to have to move our table over to the side of the bed?
Yes.
Okay.
And that's for every skill. You'll do that for every skill.
Yeah.
And you'll decide, you can go ahead and shut that off, Rachel.